Hello, everyone. Thanks for coming back. And I've been assigned to this panel again. Thank you all for being here. And this is a CHW community panel. We are very excited to share this screen with all these amazing panelists who represent the diversity in our communities, the communities that we're serving here in Utah. Their passion and expertise as a community health workers definitely needs not a special introduction because they are amazing and I'm pretty sure a lot of you know them. As everything that has been shared today is inspire, is powerful to hear each one of them. And thank you for taking the time to be here with us to the panelists because many times we see the overall data and outcomes of the work of community health workers, everything that they do, but we don't get to hear some of the stories of individual CHWs and their experiences in their position, in their organization and the job that they do. Uh, Today, as everything we were preparing for this panel, and after listening the panel that we just had before lunch, uh, we're going to have another conversation because we hear the stakeholders, the people that are in supporting this movement of community health workers and promotores. And now it's time to hear the voices of CHWs, the ones that are outside working in the community, facing these times, the challenging times. And we're going to have that flow conversation, a natural conversation without any specific model. We're just going to have a conversation with our lovely CHWs. And for the panel, we have Maria Guadarrama. Maria Guadarrama is with us today. She represents the UHPP organization. We have Lisia Santini. She represents the UPIHC organization. You will know what it means in a little while. Don't panic, because I'm like you. All these letters and words, I don't know exactly what it means, but we will learn soon. We have with us Ivana Holiday. She is from the Urban Indian Center. She represents that organization. We have Cathy Wolfsfeld. I hope I said it correctly, Cathy. I apologize because you know me, I always have trouble with words in English, but welcome. Cathy represents the Baptist Church, and she will share with us what she is doing. And we have the champion. We have Yehemy Zavala from Comunidades Unidas with us as well. Now she is part of the panel. She is with us now. And I would like, please, if you take a time to present yourselves, give a brief introduction of what you're doing, who you are, and what work do you do in your organizations. And let's start with Cathy. Welcome, Cathy.
Thank you, Jeannette. And you did wonderfully with my last name. It's not English, but it is German. So now you can say you speak a little German, about as much as I do. So my name is Cathy Wolfsfeld. I work out of the Calvary Baptist Church in Salt Lake City, and I work with the African American community. I also work with the COVID, with the medical students with the Utah AHEC program. And I work with all disciplines. I focus primarily on high blood pressure and diabetes. And I am a little different community health worker, as I don't work out of a clinic or with doctors, but I work out of the church. And so working with the 7 domains of health, I start with the spiritual aspect, and then I work outwards from there with financial and emotional. But I work primarily with the congregation of the Calvary Baptist Church. And through there, I give direction as far as resources. So that's my part of the community health program. Thank you, Jeannette.
Oh, sorry, I was in mute. Thank you, Cathy. Welcome to this panel. Let's go with Ivana.
Hello, Yate, She'er, holiday, and Chef, my dish kitchen is the Bethlehem Bashichi, Kia Ani Dashiche, Do Betani Dashinella. My name is Ivana Holiday. I am from the Jeannette tribe, Navajo tribe, and I worked as a community wellness liaison in partnership with the Salt Lake Public Library and the Urban Indian Center. I worked with community members on providing them with health resources and health information. And that's just a little bit about what I did.
Thank you, Ivana. Welcome to the panel. Thanks for being here. Let's go with Lisia.
Hello, everyone. I'm the coordinator for the CCP project with the Utah Pacific Islander Health Coalition. So the letters that Jeannette was spelling out earlier, also known as UPIC. I coordinate, so right now our team, we have about 17 community health workers. And then I also oversee the home visitation program for the Children's Service Society, and they have also joined the CCP project. We've partnered with so many of you, and I'm excited to be here. Thank you for having me.
Thank you, Lisia. I appreciate you being here. Let's go with Yehemy.
Hi, buenas tardes to all promotoras. Also listening to us. Muchas gracias a las promotoras que nos escuchan el día de hoy, en español también. My name is Yehemy Zavala Orozco. I work as a promotora. And also I am the program director at Comunidades Unidas. Even though I do not identify as a female, I love to connect myself with Promotora and the Promotora movement that started with the Latino Hispanic community. So I represent the Latinx immigrant community in this panel, and I represent my organization, Comunidades Unidas. I also work, as you heard in the past, in the section, and I have had a huge history with the community health worker movement in the state of Utah. And I've been working as promotora for the past 10 years. And also, I can tell you that not just as a promotora, but as a supervisor, I have a huge privilege. This huge privilege has been, not just to have the hat of promotora or community health worker, but also to have the other hat, which is the person who supervises them or the person who provides guidance to them. And now, being a programs director at my organization, I always have very mindfully thinking that every single movement, action, or work that I will do will be connected and tied to community health workers or promotoras. So it's been a privilege, and I am so thankful for you having me here.
Thank you, Yehemy. Welcome. And Maria Guadarrama. Where is Maria? My dear Maria.
Here I am. Hi everyone. Thank you for allowing me to share this opportunity here with you guys today. I'm super excited to be here. My name is Maria Guadarrama. I am with Utah Health Policy Project, and I am a health access assister under the program Take Care Utah. As you know, we offer outreach and enrollment assistance for health insurance options. We help people get connected to health insurance, and then just help them with the whole application process for insurance with Medicaid, CHIP, and the marketplace. We serve all people at Take Care Utah, but I would say that about 70 to 80% of the people that we serve are of Hispanic Latino communities. And we have our team who speaks Spanish, English. We have a gentleman also who speaks Arabic. So we also offer services to the refugee community. And yeah,
Wow. Wow. You see, I told you this group is amazing, all the job that they are doing. And we hear the panel, what they share with us about the challenges and the expectations and all the work that they are been doing, you know, as a stakeholders, as a supporters, as an organization. But now we would like to know from you as a community health workers working in the community, when everything started with the pandemic and your organization was called to work with members of the community doing something with COVID, what was the challenges that you as a community health workers face, you know, in this new way to work with people, and what services were you able to provide to those community members? And just to give the opportunity and flow, let's start with Lisia and then go to the flow.
I think the challenges were really, well, for us was to really figure out what the pandemic really means, understanding how under-resourced our communities were, and trying to figure out what the work and what works and then what doesn't. Building capacity for the community to provide services for them, listening to our communities, and being that voice to the Utah Health Department Health Disparities, and figuring out how to educate our community in a way that would be welcoming. So.
Thank you, Lisia. Cathy?
Well, seeing how we work out of the church, our challenge was to find out what our community needed, and then logistically, how to get it to them and staying safe. So Calvary Church has received a grant from the state of Utah to distribute food to the community. And so it was, okay, how do we get people to put the food together, to get the boxes together, to get it to the community? So that was a challenge. Just staying safe throughout the help, but we logistically made it happen. So every other week, Calvary has a food drop at the church. People drive through, they just put a couple of boxes of food in their trunk and keep going. So we made it work for the community as far as food insecurity is concerned. That was our first step.
Thank you, Cathy. Ivana?
Yeah, so I kind of wanted to echo what Cathy was saying. It was kind of a new challenge to actually safely and effectively provide resources and information to our community members. And we found ways in doing that with like social media and bringing awareness to the pandemic and how to actually educate community members who do use Facebook as a source of information. And I think that with me working at the library, it was kind of hard to not have that face-to-face connection with community members. That's where we really connected with people, and doing outreaches at the Urban Indian Center, I was not able to, you know, do that and build that connection with the community members and build trust. So I think those are the challenges that I saw.
Thank you, Ivana. Maria?
Yeah, I would definitely echo everyone's comment as far as, you know, making sure that communities were secure in basic needs, right? First, I would say from our end at, you know, Utah Health Policy Project, we are serving the health insurance need of it. And so we are kind of a hub for our clients to make sure that we have information of other resources in the community, right? And so from our end, I would say, right, as you know, the situation happened, we were just trying to make sure to connect with state entities on, you know, what policies were going to be put in place, and then just making sure that that information was going to be shared with, you know, our communities and with our clients, whether it was like through social media or just the clients that were calling in on a constant. And then, you know, just making sure that the organization had everything in place for the clients to access, still have access to us, right? Whether it was, you know, phone, or every person getting like a Google number, and putting up all that information and sharing all that information with our community partners. But yeah, I think the biggest part was that, you know, even though we were facing, and we are facing still a pandemic, a health crisis, health insurance is in a way kind of like third or fourth, right, on the minds of the communities, because we understand that, you know, our communities were still going out working in March, April, and we still continue, right, with the types of jobs, and then just also trying to share the information of like the costs was also, you know, how we reach the community is like, the COVID-19 is free, you shouldn't be getting charged for this, etc. So I think on our part, a lot of it was making sure to stay connected with state entities, following through with those policies, and then disseminating that information to our clients and the public.
Thank you, Maria. Yehemy?
I made a list. I made a list. I forgot to mention, Comunidades Unidas provides services to the Latino community, or to the Latino immigrant community in the state of Utah. We focus our work in empowerment, and we do provide a lot of healthcare, as well as Cathy was mentioning, we do base our work on the 7 domains of health. We do believe that a comprehensive and integral support for our individuals or community members in the state of Utah, it's a key factor for them to move forward with their lives. So saying that, the challenges that we faced at the beginning was to train promotoras. Most of our promotoras are monolingual, they speak Spanish, and you know, for them to have face-to-face interaction, a person-to-person interaction, to utilize digital media, or you know, another forms of communication was a huge challenge for us. We will have to make sure that we will provide training over training until they finally felt comfortable utilizing them, and also teaching their peers also to do the same, accepting the policies provided by the Department of Health. Even though, you know, we are part of the community COVID partnership and other grants, because of the time constraining and because everything went so fast, we didn't have time to negotiate. So we had to accept what they give us. And that means that we will have to bring to our community health workers to, you know, a justification. We will have to think a justification of, you know, why we're paying some community health workers one amount of money and why we are paying another community health workers another amount of money. Prioritizing where we are going to go. You know, as one of the few Latino organizations focusing on Latinos and immigrants in the state of Utah, we had a lot of work. There is more than 300,000 Latinos in the state of Utah right now. And as you can imagine, or we have to stretch as thin as we will possible to decide where we were going to tackle, providing services, doing advocacy, doing training, doing guidance to our peers, doing guidance to our other organizations. Racism was something that we experienced since the beginning of the pandemic. And I can tell you, because as you might not know, Latinos in the state of Utah have different immigration status. And you know, we have different colors as well in the skin. So, you know, if we started to see a lot of racism around the state, not just with different entities, but also within their own communities, because we are, you know, since this rhetoric of the good immigrant and the bad immigrant is happening throughout the past 4 years, you know, who is a good immigrant, who is the bad immigrant here, who deserves to have services, who deserves to have benefits, and, you know, to see these conflicts within our own communities were very harmful, you know, and also to be an example. Another challenge I think that we was to be an example of how to do self-care. You know, we as supervisors or leaders in our community, we have to work more than 70 hours a week. That's something that I see a lot of nodding heads, you know, because it's true. You know, even though we need to be an example, we also understood that we needed to move forward and we needed to take, you know, just to make sure that our community members were going to have what they needed. And then boom, the earthquake hit us, and then boom, another earthquake hit us, and then another bomb, you know, just so many different things because of climate change as well that have, you know, have been shaking us throughout the entire year, you know, and also the death of our peers. You know, the passing of Margarita for me was specifically super harmful. It's been a month and I'm still crying every single time that I talk about her, because it was something that it could be avoided if we will have the money to pay them to get health insurance, to get the things that they needed. So, you know, there is a lot of struggles that we unfortunately would have to live, and we continue living with this. So yeah.
Thank you, Yehemy, and thank you for reminding us that, right, that we are in that vulnerable space, right? A lot of you talk about the needs of the community, the way to meet them the safe way, and you know, in those needs, what is I know there is so many barriers, but how specifically for you as a community can working with your communities? What is the biggest challenge to connect what resource and how you overcome those barriers, you know, in order to help your community members? And I will be open that discussion, and then you can jump in, any one of you, the 5 panelists.
The biggest challenges in my community is food and housing. And it all intertwines, because people that used to be furloughed are now laid off. They're depending on their weekly unemployment, which has been cut. They depend on, and so they tend to move back home with their parents and grandparents. And so now we have multi-generational households that before the pandemic was not true. And, you know, and that the lack of food, more people, less money, less food. So, and so it's very prevalent and it's very harmful in the community, because the jobs are leaving and people are now doubling, tripling up in one household. And so it's hard to keep the spread down if you can't physically distance from anyone.
Thank you, Cathy. I'm having trouble with my audio. I don't know if you can hear me very well, but Ivana.
Yeah, I kind of wanted to, it's kind of very similar to what Cathy was saying. There are like a lot more multi-generational households, and not being able to, like if someone tested positive for COVID in a household, it's very hard for that person to isolate themselves from the rest of the household members. And we see that a lot within our communities. And then just not being able to work from home. A lot of people are out in the industries doing service work, food service work like that. And it's very hard for them to, you know, to take precautions about getting COVID and, you know, spreading it to their households. And then another aspect would probably be social distancing at this time. A lot of community members are not able to find comfort in their family physically and emotionally. And a lot of Native American families are not able to, you know, participate in their traditional burial practices. And many of them find comfort in their traditional ceremonies too as well. So a lot of that is, you know, is a huge challenge for community members.
Thank you, Ivana. Yehemy, would you please take over? I will try to fix
Yes.
this.
It's okay. Yeah, gracias, Jeannette. Maria, would you like to go next?
Yeah, thanks, Yehemy. I started writing things too, like you do. I'm learning from the best. I think thinking about this question for me, it reminds me of the role of community health workers and playing many hats, right? Because as a health access assister, with UHPP, we want to make sure that people get and stay connected to health insurance enrollment piece. But as a CHW, my mind, it just goes to like, these are the type of conversations that I'm hearing from my community, right? From my friends, from my family, from my neighbors. I hope that I'm not the only one, but there were conversations, about what COVID-19 meant, to our families, making sure that message came across, like, wearing your masks, like right now, keeping social distancing and, not visiting each other. And, Ivana, I can relate, how you mentioned about their, specific ceremonies, Hispanic families, like we, are one family, and it could be like 50 in the room, right? And so it was like these conversations of like, let's not all visit each other right now, or, let's make sure that la abuela is safe, or I have a sister who is in stage 4 breast cancer. And so just making sure that, I'm like calling everybody, sure to kind of wait to hear what other information we get, right, from state policies or from other community partners. And so, as I had these organic conversations with also clients and family and neighbors, it was apparent that we just needed to make sure to come across a message of like caring and an out of love for one another. That's kind of, I hope to say that, like, that's my kind of CHW role, right? Like, this is what I'm hearing from the state. This is what I'm hearing from other community members. These are the things that we can keep in place to make sure that, numbers stay low, or our families and our communities stay protected. Even though I understand that there are many barriers, right? Like this continuous of like the essential jobs and et cetera. So I would say that was one of the roles, was just like, how do we communicate and share this message with our communities? And then on the enrollment piece, as a health access assister, I would say that, earlier in this year, we saw the public charge came out. And so state policies also really impacted the decision of, clients going and getting a test, because, they didn't know if it was going to be something, if it was going to be a repercussion against their immigration status. They didn't know if like the information was going to be shared with state policies. And then the other thing too, as well, was the appointment times that we had to help people, because of the new ways of technology use. We were going from a 30-minute appointment to like an hour and a half, and, helping and guiding clients to access, video chat, or, a Zoom link, or we use Teams, or a Teams link. And then how do we disseminate, like, the paperwork information, and a lot of clients were still going into the office. And I think this was mentioned before, is like, what does this message mean of like having COVID? I think Tessa mentioned it earlier, that in other countries, they were experiencing another health crisis. And so when we were when we closed the office doors, a lot of clients were still like, I don't understand, why are you closed, right? And, we still wanted to make sure that they had all the access information to reach us to get enrolled and get connected to health insurance, but still try to share that message, of, minimizing numbers and stuff. The other thing I would say too is, funding for the nonprofit organizations. UHPP TCU, we actually didn't even get any funding until late September. I'm kind of gonna assume that most of the organizations were around that same time of maybe getting additional funding. And, you know, I think that's also important, right? Because at the very beginning, it was like, this is our mission to focus on health insurance enrollment, even though we want to be offering more, you know, assistance and more messaging, like, which one do we pick as an organization? So I think funding was definitely a thing. And then of course, just, you know, within our organization and working from home, making sure that the staff was also at a, you know, mental and emotional state of continuing to offer services. And we also have, you know, staff who had to go through these same issues, you know, who they had to stay home with their kiddos, you know, from school. And so they had to navigate working a full time and making sure that their kids, you know, were at home feeling comfortable. So yeah, that's what I wrote down.
Muchas gracias, Maria. I do definitely echo everything that you all say. You know, the fact that sometimes, because we're part of the community, because we, you know, it's not just that we represent the community, which I don't think that I can do it, you know, accurately, but, you know, to be part of the community, to be part of the movement, it creates another challenge, because you are not just, you know, fighting with the virus, but also with your own willingness to go and hug your mom if you don't live with them, to go and visit your parents. You know, we are a very people's people person, I believe. Most of the people that were here, and it has been a huge challenge, you know, to not being able to go out and, you know, hug my little niece, which is 1 year, and she does not understand why I'm not hugging her. It is challenging, you know, and, you know, all of our community members are experiencing the same. And it is hard to also lead by example. You know, I do think that's a huge challenge. So, Lisia, I know that you're missing. So it will be the same question. You know, within these challenges that we are experiencing all with COVID-19, in your community specifically, what have been the most pressing and how you have overcome them?
Thank you. So I was thinking about the beginning of our project when we first went into the pandemic. Kind of funny, the county had released numbers on our Pacific Islanders, and the numbers were coming out, but we're a very small community, but the stories weren't coming out. And so we were noticing a lot of community members, you know, being very private about the stories of being infected with COVID. So we knew it was happening. We just knew the conversations weren't happening. And so in the beginning parts, we had organizers come together with virtual meetings, town halls, things like that, to create that open discussion, to be okay with saying, yes, I have COVID, let's go ahead and move forward, and how am I gonna deal with that? And out of that, we've also developed what we call now the UPIHC table. We also, you know, partnered, of course, with the Salt Lake County with mass distributions. We had our, you know, with Pictar, they were able to share their PI business list with us. So we went through our PI businesses and organizations and working with our CHWs to get the word out that we were going to be that resource for them. You know, and I think a lot of what we struggled with in the beginning, I think now that we have the trust of our, a lot of our Pacific Islander leaders to be on the same page. And we know it's a work in progress with the different Pacific Islander organizations as well as churches. And somebody had mentioned about keeping the staff safe. And that was the reason for bringing a lot more community health workers onto our team, because we understood the high rate that infection rate that was going on within our community. But even with that, I mean, you mentioned, you know, having not having that chance to not be able to even see my parents. I mean, I see them virtually. I've done drop-offs to try to help keep them safe. That's not even easy. And we mentioned earlier, I mean, just and sorry, I said, you know, I keep hearing her name come up, and you know, we want to continue to honor the work through Margarita as well. And so that it's still a bit raw. And so with that, I know that our people are a very social people. And so Ivana brought up about traditions, you know, and trying to be there as a community health worker while our community, you know, we try not to police and say no more, even though we know what the safety protocols are. But when we sit there and say, you know what, if you're going to have an event, please, we ask, keep it small, or we'll provide a community health worker to come and do temperature checks. And so trying to navigate, you know, all of that has been a journey for sure. So yeah, so shout out to the team, all the community health workers out there. I get it. So thank you.
Yes, I want to finalize on behalf of Jeannette with the last question. It will be the same question I asked the last panel that we have the discussion, but through your eyes. What would you recommend? People who want to work with you, or people who want to start to integrate your work in their organizations, what would you recommend them to have best practices or just to recommend them to make sure that we can have an amazing partnership with them? Ivana, do you want to start?
Yeah, I can start. So I think it would be important for organizations who want to work with community health workers to listen and to understand that we know our communities and we're doing the best that we can to really meet their expectations, but also just learning from us. We are, as much as we are learning from them, and I just want to say that to our future organizations or community allies who are interested in working with community health workers.
Thank you. Cathy?
I say, you know, since I'm a community health worker outside the box, is don't limit yourself to what is status quo. A community health worker can be an asset in all walks of life, in every one of those 7 domains of health. And so it's use your imagination, don't limit yourself. People that really know and love their community will be able to help their community in some way, even if it's a small way. And so that's mine, because I'm not a typical community health worker, and I advocate for outside the box.
I hear you, Cathy. I think that you and I have more in common than I have thought about it before.
Oh, amen.
Amen. Maria.
Oh man, I don't know if I can beat Cathy's. I think I turned back to the idea that community health workers are in, you know, a lot of different places and in different positions, right? I don't think someone necessarily has to come through like the clinic or, you know, this type of work, Cathy, now that you've mentioned that before. I think there are definitely community health leaders in faith-based organizations. I would also, from my perspective, I think, you know, a lot of community or a lot of stakeholders sometimes tend to think that, you know, they're being allies within the communities of color or minority communities or underserved communities. But I strongly feel like we don't necessarily need an ally. I think we need comradeship. right? We need to be at the same level as everyone. We don't need your help, you know, we need each other. And I think I struggle, I struggle with that concept. And so I also will say that I'm coming from a place of learning myself, you know, learning about community partnerships, learning from all you beautiful people that continue doing the work. And so I'm also coming from a place of learning. And I think that the more the community sees, you know, people empowered in positions and in voices and being part of the table, I think the more that community members themselves start to feel that empowerment and start to become, you know, like want to participate and want to volunteer. I know I definitely like see that, you know, through Comunidades Unidas and their promotoras, and, you know, just getting somebody from the community who never thought that they could do this type of work, all of a sudden, you know, like they're coordinating a whole program. So yeah, I think a lot of those hopefully are something that we can all work on.
Gracias, Maria.
I'm glad I didn't follow Maria.
Agree with you. Lisia.
I think the purpose is above us. And so somebody had mentioned it earlier, was to embrace community health workers. You know, just understanding that we're here to help, we're on the same team to fight the good work. I think, you know, if I stayed in my own lane, I wouldn't call Yehemy and say, hey, Yehemy, I need resource bags, or, you know, connect with OCA, who did a wonderful job hosting one of our food clinics for food distributions. If I stay in my own lane, the work, the capacity that we need to advocate for all the communities, we would just keep slowing down the work. And so I think if we could be that voice and to be heard, and having conferences like this brings the unity of the work together. So yeah, thank you.
Now it's me with the microphone. We went over time already, but I do want to emphasize one last thing. You know, here in Cathy, specifically in Maria, my organization started 21 years ago with immigrant monolingual women. Imagine the powerhouse that we have. Not for bragging about it, but it's true. Imagine the powerhouse that we have because immigrant monolingual women created Comunidades Unidas. And we are always thinking outside of the box. We have DOJs, accredited representatives who practice immigration law or practice immigration in general. You know, to help cases. And we have amazing, amazing work. Alliance do the same. There is other organizations such as Holy Cross Ministries who have the same ideas. It's just thinking out of the box and giving the opportunity. The reason that I am here is not just because you know, because I decided to do it. My boss gave me the opportunity. My organization gave me the support that we needed to continue building our skills, building our capacity. And that's what it makes, you know, an amazing collaboration within our bosses, within the agencies, and the work that we can do. Because if we have the space who can create, and, or, you know, if we have the space, the time, the environment for us to shine, we will make more things even. Because as Cathy mentioned, you know, we always think outside of the box. And I think that, you know, our work, it's just starting. I know that we are going to do amazing things in the future, and I thank you, all of you, today that you are here, that you were able to share your thoughts and your beautiful experiences in this amazing journey that we all have. And thank you, Jeannette. I know that you are not, it's a little complicated right now with your audio, but thank you, Jeannette, because at the end of the day, you know, the connections that we have with each other, as Lisia was saying, is what it keeps us up. You know, it makes us sometimes to be a little bit hurt, but also it keeps us up and, you know, call each other, you know, asking for each other's services or resources. It's such an amazing idea and such an amazing thing that we have within ourselves, and hopefully we can continue our partnership and our camaraderie, as Maria was mentioning, moving forward. Thank you.